Hey, Dr. Segrin here for another video lecture on coronavirus. Um, this lecture is going to be about epidemiology. And broadly, what epidemiology is the study of disease and how it spreads and how you can control that spread. That's broadly what epidemiology refers to. And our lecture today is going to focus on one aspect of epidemiology, and next lecture will be on other various aspects of epidemiology. But for starters, today we are going to talk about the most important thing that has to do with the spread of a disease.
It's the biggest shopping weekend of the year.
I think we need to consider closing the schools down.
And who stays home with the kids? People that work at stores, government workers, people that work at hospitals. When will we know what this is? What causes it? What cures it? Things that keep people calm.
What we need to determine is this. For every person who gets sick, how many other people are they likely to infect? So, for seasonal flu, that's usually about 1. Smallpox, on the other hand, it's over 3. Now, before we had a vaccine, polio spread at a rate between 4 and 6. Now, we call that number the R naught. R stands for the reproductive rate of the virus.
Any ideas what that might be for this?
How fast it multiplies depends on a variety of factors. The incubation period, how long a person is contagious. Sometimes people can be contagious without even having symptoms. We need to know that too. And we need to know how big the population of people susceptible to the virus might be.
So far, that appears to be everyone with hands, a mouth, and a nose.
Thank you, Kate Winslet. Blanchett. Winslet. Kate Winslet is right. The reproductive rate is really the most important part of understanding a disease, and that is what we will take this entire video lecture talking about. So here it is, Epidemiology Part 1, Reproductive Rate and Modeling. So let's get into it. What exactly is the reproductive rate, or the R naught, as she referred to it in the video? By the way, that was the movie Contagion. If you haven't watched it, you should definitely go out. It's one of the better movies on disease. This is nothing new, but we've talked repeatedly about how viruses can't reproduce on their own. They need a host. And so if it cannot reproduce on its own, the way you measure its reproduction is basically how many hosts a virus can infect. And in simplest terms, how we express this is the number of people that are infected by the average sick person. So if you have one person that's sick with the virus's reproduction depends on getting into new hosts. So if you have one person that's sick, how many more sick people are made from that one person? And this has to do with how diseases are contagious. So you can imagine if a sick person goes into a crowded subway and is coughing, those viruses could spread to several people, and one sick person could maybe infect 5 or 10 people in a crowded subway like this. And so that would be a very high reproductive rate for a virus. If you're not in a crowded subway, let's say maybe the person that's sick is staying at home and isn't going to work, isn't using public transportation, isn't going to the store, and doesn't infect anybody else, that would be a very low reproductive rate for the virus. So what this means for viruses is that they will grow in number. If we talk about the number of infected people, they grow exponentially. And the idea here is that if we have a reproductive rate of anything higher than 1, which means that the average sick person infects at least one person or more than one person, that would be a reproductive rate of greater than 1, we get something called exponential growth. If the reproductive rate is exactly 1, then actually we just have stable virus amounts in a population. And if a reproductive rate is less than 1, then we have something called exponential decay. So let's talk about exponential growth. This is a very dangerous idea, and I will let the movie Contagion take it away once again.
Tell them what an R naught of 2 really means, Dr. Cheever. Teach them some math, No? I'll do it. On day 1, there were 2 people with it, and then there were 4, and then it was 16, and you think you've got it in front of you. But next it's 256, and then it's 65,000, and it's behind you and above you and all around you. In 30 steps, it's 1 billion sick. 3 months. It's a math problem you can do on a napkin, and that's where we're headed. And that's why you won't even tell us the number of the dead, will you, Dr. Cheever? But you'll tell your friends when to get out of Chicago before anyone else has a chance.
Thank you, Jude Law. Very, very good explanation. What is Jude Law talking about in this? Yes, this is exponential growth. If you have a reproductive rate of 2, or an R naught of 2, what happens is that you have one person who infects 2 people. Those 2 people each infect 2 other people. And so now you have 4 people with it. And then those 4 people each infect 2 other people. Then you have 8. Those 8 infect another 2. So you have 16, 32, 64, etc. And you see that the rate of growth is actually accelerating over time. Each generation of viruses, the number grows greater than the previous generation. So in our little diagram here to our right, our first generation, going from 1 to 2, the number of sick people only grew by 1. Going to the next generation of sick people, 2 to 4, it grew by 2. So 2 is greater than 1, so it's growing at a faster rate than it was the previous generation. And then from 4 to 8, it's growing by 4, and so on and so forth. So actually what you see is a kind of an explosion of infections in cases with viruses that have reproductive rates higher than 1. Okay, let's move on to exponential decay. This is kind of the good thing about viruses, is that if you can bring the reproductive rate to less than 1, they will exponentially decline or decay in number. And we can sort of visualize this by just reversing our previous trend. So if we have a reproductive rate of 1/2 or 0.5, what that means is that if we start with 8 people that are infected, only half of them infect somebody else. So we have 8, and only half of that 8 is spreading the infection. And so instead of going up in numbers, we're going down very quickly in numbers. So we have 8, and then only half of those 8 are actually spreading the virus. So then we go to 4 in the next generation with exponential decay. And then those 4, only half are spreading it. So then we go to 2, and then to 1, and then to nobody is the idea. So it's kind of like viruses are kind of boom and bust. When they are growing in number, they're growing very quickly, and when they're declining in number, they're usually declining very quickly. So they're pretty unique in this way. And that brings up a really interesting point, is that in the movie, they both only refer to the R naught, the reproductive rate. That actually is not the reproductive rate, that is the baseline reproductive rate at the start of an epidemic or a pandemic. Reproductive rate is not constant. It will change over time. So for example, you can reduce reproductive rate of a virus by things like social distancing, wearing masks, herd immunity, and vaccines, all those concepts that we talked about in the last video. For example, let's say we had a virus that had a reproductive rate of 2, like our last diagram that we were looking at. If half of the people in the population are wearing a mask or are already immune to the virus, like herd immunity or vaccine, this scenario on the right starts to play out. You have the one person who would normally spread it to 2 other people, but our little star shows that the people that it's spreading to is either immune or is wearing a mask. He doesn't get the virus, and it only spreads to one other person. And because that one guy, our star person here, he's immune or he's wearing a mask, because he didn't get it, he's not going to spread it to anybody else. And so that entire chain of spread is cut off. And so on and so forth. If you have half of the population immune, if you have a reproductive rate of 2, that will cut the reproductive rate in half, and it goes to 1. And you can see, instead of having this virus explode and decimate a population, you can slow the spread, slow the rate of the spread with things like herd immunity and masks, social distancing, etc. So that kind of helps summarize some various ideas on reproductive rate and what it means. Just to kind of review so far, if you have a reproductive rate of higher than 1, that means the average person is infecting more than one person. That grows out of control. And if you have a reproductive rate of less than 1, you get exponential decay, and so things stabilize very quickly, and the virus's numbers dramatically decrease over time. So now is unfortunately the moment where, Kate Winslet said that the most important thing to know is the reproductive rate of a virus. Can we figure that out for this virus? How would we figure that out? And what would that mean moving forward, making predictions about the future? That's where we're going to head with the rest of this lecture. And unfortunately, you're going to have to look at about 50,000 different graphs here as we try to make sense of what's happening in the world. So if you don't like graphs, I apologize. The rest of this is pretty much all graphs. And again, this is mathematical, but it's not, we're not getting into any advanced formula or anything. So don't freak out when you see graphs. I'll walk you through them, and it is going to be all right. So if we graph something like exponential growth and exponential decay, this is what those curves look like. So let's start on the left. Exponential growth, you have population and time. I just pulled these off the internet. So population here would be like the number infected by a virus. So what you see is that because each jump in generation, the number is increasing and increasing more than the last jump. Over time, you see that this curve gets steeper and steeper, increasing. So this is basically, if you just plot the numbers from this diagram, where you go 1 to 2 to 4 to 8 to 16 to 32, over time, this is what the graph looks like. You can see we say it looks kind of like a J. It's a J-shaped curve. Exponential decay is the graph on the right side. So if you start with 32 and then you go down to 16, 8, 4, 2, 1, you can see it dramatically drops off, and then the actual steepness of the slope gets less and less steep over time. So that is exponential growth and exponential decay when you're talking about graphs. So if we're looking at data from different countries, if the data kind of looks like the data on the left, that means that the number of cases is exponentially growing. And if the data looks more like on the right, then it's exponentially decaying. And if it's kind of flat or leveling, then we might say that's more like a reproductive rate of 1. So just to reiterate, left would be a reproductive rate of higher than 1, right graph would be a reproductive rate of less than 1, and if it's flat, that means that we're roughly at a reproductive rate of 1. Okay, so let's talk about the kind of standard, what we would call epidemiological curve. When I was in school, I learned about these, and unlike molecular biology, I actually did get an A in this class. I really enjoyed this class. Microbial ecology was awesome. So this is our standard epidemiological curve. And what you can see is that it kind of looks like if you put the last two curves together with a little hump in the middle, then that would be the epidemiological curve. So it's basically a combination of exponential growth and exponential decay. This curve is actually based off the concept of herd immunity, nothing else. So the idea is that a virus starts taking off in a population, like in humans, and it's growing crazy fast, and it's exponentially increasing over time. What happens is that as more and more people get infected, more and more people become immune, and because more and more people are immune, that limits the virus's reproduction, right? Kind of like this diagram we saw. Imagine the stars here are people that are immune. The more people that get immune, the less fast the virus spreads, and over time, once you get to a high enough immunity, the reproductive rate goes below 1, and then you have exponential decay, and the number of infected people declines very quickly. So that's your standard epidemiological curve. So if you've been watching the news recently, you might have heard all this stuff about slowing the spread and seeing these two different curves where one is very, very dramatic, sharp increase, and then lots of people die, and it's no good. You can see Trump here, it's not looking happy. And the curve on the right, the slow the spread curve, is one where the curve is much more gentle, and then it decreases, and not as many people die. And that was kind of why we were doing all this social distancing stuff. At the time, I was a little bit confused because generally these curves are determined by herd immunity, not so much by social distancing or quarantine efforts. So I was kind of a bit confused by that. So my understanding of this curve was that curve 1 is if we don't do anything and just let the disease spread. And curve 2 is if we do things, we can get the reproductive rate low enough, but not actually under 1, and herd immunity still applies. We just slow down this curve enough to give hospitals time to react. It seems to turn out now that people are saying, no, we're not going to get herd immunity, that we're going to actually get rid of the virus before it comes to that, and that our social distancing efforts are actually going to reduce the reproductive rate underneath 1 and actually kill off the virus before we have to acquire herd immunity. And so majority of us will not get the virus. That is intriguing, but let's look at if that's actually possible or not. And it'll make more sense as we go through some examples, I think, to you. So the reason I was a bit skeptical that quarantine could generate this curve is because this curve is kind of like a mirror image. We call it a bell-shaped curve. So the increase and the decrease are almost like symmetrical, perfect symmetry, like a mirror to each other. And that's because herd immunity generates this symmetry. The more people that get it and are immune, the more the reproductive rate decreases over time, and it just works out that you get this nice even curve. So, for example, to create such a curve, if you had a reproductive rate of 3 initially, you would basically end up with a reproductive rate of something like 1/3 by the end of it, and that's what's going to create this nice balanced curve. Real life quarantines do not have this balanced shape. I'm going to go through several examples to show you what that means. We'll start with China at first, and we'll get to whether or not the Chinese data is actually worth trusting or not. But you can see here, this is the real Chinese data that's been released. This is their curve over time of active cases, and you can see that the curve up, the exponential growth portion of their curve, is a lot steeper, and yeah, it's a little bit wobbly there, but it's a lot steeper than the curve down. You can see the curve up takes place over 2.5 to 3 weeks, January 22nd to about February 15th. You can get from is the entire curve up, whereas the curve down is more like February 15th over to April 11th. Instead of being 2 or 3 weeks, it's more like 2 months, the curve down. So the curve up is much faster than the curve down. This is because there was no herd immunity in China. They lowered the virus count by quarantining, by making sure everybody's indoors, not going to the store, and not spreading the virus around. Okay, so what does this mean? What kind of reproductive rates are we looking at here? And ultimately, what we want to know is how long do we have to keep up our quarantine to actually get to a place where we have no more cases? And to do that, we have to create what's called a epidemiological model. And I want to go into a little bit of detail on how these work, because there is tons and tons of talk on TV and on the news about different models, and somebody says this and somebody says that. I actually made my own model about a month and a half ago, and that's why at some point in February I was already calling that we wouldn't be finishing school this year, is because I was just modeling it on my own and I could tell we were in for a really long haul. So you might think, oh, making some epidemiological model is unbelievably complicated. It's a little bit complicated, but actually it's not too bad. It's not too hard. So I'm going to explain how you would model it and show you my model, and we'll figure out what we can learn from this modeling process. By the way, I'm a bit slow getting my video out this week. Part of the reason is because I've been working on a lot of stuff. So let's talk about how you would model an epidemic. The most simple model, and the one that I made, is something called an SIR model. I like to call it a bin model. I learned about these in college, and it didn't really sink into me what the heck was going on. You understand them better when you actually build them. But I'll explain it. It's very simple. The idea is you have time progressing. So you can see up here at the top left, we're at day 1. And you start your model with an incubator. Incubator refers to somebody who has the virus who is not yet sick. We will talk more about this in the next video lecture, but I think most people know that if somebody coughs on you with the virus, you don't feel sick right away. It might take some days to become sick. And the idea is that the virus has to slowly infect more and more cells in your body before you actually feel sick. So that would be called an incubator, somebody who has the virus and isn't yet sick. So on day 1, let's just imagine we have one incubator. Each one of these little boxes, incubators, sick, recovered, hospitalized, and dead, refer to the number. They're basically just categories. Everybody who gets the virus is going to go into one of these categories over time. And so how does that work? Well, let's imagine it. The incubation time for this virus is something like 5 or 6 days. So if we move to day 6, what we're going to see is that our one incubator is now moving over to another category. He is now sick. So that one guy is now bouncing around. And this is where reproductive rate comes in. This one sick person is going to infect some number of other people. So if we said it was a reproductive rate of, let's just say 3, what we would expect is that when we get to, I don't know, a couple more days, that one sick person is going to have infected another 3 people. And so now we have 1 sick person, 3 incubators, and our reproductive rate would actually be 3. And that's how we get our new incubator count. And slowly over time, we're going to have more sick people. Those sick people are going to create more incubators, so on and so forth. Some of those sick people are going to get better, and so they're going to go move over to the recovery column. Some people are going to become too sick and have to go to the hospital. That's going to be our hospitalization rate. Some people in the hospital, if they don't get any better, they could die. That would be our death rate. So all of these terms, basically, you can just simulate what's going to happen with the disease if you know basically 4 things: reproduction rate, hospitalization rate, death rate, recovery rate. You can figure it out. And just hypothetically how this could progress is like at day 30, now because we've had several generations of incubators and people getting sick and creating more incubators, we could have like 60 incubators, 20 people sick, 4 have already gotten better, 1 is in the hospital, nobody's even died yet. That's kind of how we can imagine it. And then day 60 or 100, this is going to look completely different, right? So that's how the model works. And you can build one in any kind of program. I made mine in Microsoft Excel, and I will make that available to you if you want to play around with the numbers yourself. It's not too complicated, although you do have to write some serious crazy formulas. You can see mine here. I think this is the craziest formula I had to write. D10 times 1 minus D1 plus F13 times 1 minus F. That's just, you have to code it into a language. But I made my own epidemiological model, so I can make my own predictions on what's going on. When I look at the Chinese data, I can actually match this curve with my model and figure out what the reproduction rate was over time, assuming the Chinese data is good. And here is my curve that matches the Chinese model. You can match their numbers very accurately if you use a reproductive rate of 2.5 initially, and that reproductive rate goes down to 0.6 over a matter of a few weeks. And that's what's going on with the Chinese data. So that's cool. You should keep in mind that this data may not actually be all that accurate. Why not? Well, China was the first country that got this virus, so their testing was probably a little bit slower than maybe other countries that had time to develop tests. The Chinese government isn't exactly the best at sharing data. For example, the last 2 or 3 weeks, the numbers have been leveling off, and China's only reporting somewhere between 30 and 100 new cases each day. However, if you look at the news about China, they just had to build another pop-up hospital in a town near the Russian border to deal with this coronavirus spread. And to me, it seems a little bit strange that if you're only having 30 to 100 cases a day, that you have to build a new hospital somewhere. So, point is, Chinese might be lying. And also, something else that's really fishy about this story is that Russia has way fewer cases than the rest of Europe. So why are they having to build a hospital to protect against Russia when Russia doesn't have many cases? Guess what? Russia has a history of lying about data. Did you know that when the Chernobyl nuclear reactor exploded, it released 400 times more radiation than a nuclear bomb? But only 30 people died. So none of these numbers might be accurate. But if we wanted to, we can recreate these different curves for different countries and figure out what the reproductive rate of different countries is. So let's move to a country where I actually do trust the data. South Korea. South Korea is widely regarded as the country that has handled this crisis better than almost anybody else. Their peak case count only got close to 8,000 at a time, and compared to a country, they were having exponential growth really, really quickly about the same time as Italy, and Italy got up to like, I don't know, peak count was like 100,000 cases, whereas Korea barely got to 7,000. So they did a really, really good job testing and controlling the spread and collecting data. And so I really do trust this data in this curve. Unfortunately, what do you notice about this? The exponential growth up is extremely, extremely fast. And the exponential growth, the exponential decay is extremely slow comparatively. And with my model, you can actually match up, and this is something approximately, this actually gets to their data they don't quite look exactly the same. That's because the scales are a little different, but the data matches up really, really well. If you start with a reproductive rate between 3 and 4, you get this rapid expansion. And then if they brought the reproductive rate down to 0.8, you get this curve. And you have this very rapid upswing, exponential growth, and a very slow downswing. Why do we care about this? Well, because it does not look like our nice bell curve that, President Trump was toting, right? This curve is not balanced. The reproductive rate of the upswing was much faster than the downswing. And that is indicative that the quarantine efforts there are reducing the count of the virus, but it's happening very slowly. According to my model, Korea is going to have to keep this up for another 2 to 3 months before they actually have no more cases. And that should be very alarming to you because the United States has way, 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 way more cases than Korea. So how long is it going to take for us to bring down this curve? So let's go ahead and look at the United States data. Yeah, you notice something a little different here. Our curve's not even going down yet. It's still going up. So everybody talking about like we're going back to school or we're reopening the economy, we haven't even really gotten to the peak yet. And I've been wondering this last week, are we even going to get to a peak? Or is this number just going to keep going up? Are we even going to have a reproductive rate of less than 1? And yeah, my model can recreate this. Reproductive rate of 2.5, you can get these very similar numbers. And the big question is, what is the reproductive rate now? Are we actually going to peak and come back down again? Or is it just going to keep going up? How would we even know if that's going to happen? There is one way to do this. You can tell if it's going to peak a little bit ahead of time by looking at the daily new cases. And I'm not going to go into a ton of explanation about this, but the idea is that if the number of daily new cases is going down, that means the reproductive rate has to be under 1 and that you have to be declining and near your peak. And luckily for the United States, over the last 5 or 6 days, the trend is decreasing the new daily cases by about 500 to 1,000 per day. I'll keep an eye on this and I'll give you an update next week on how it's doing. But if this trend continues, we will have our peak within the next week or so. So that's good. At least it's not going to get any worse than it is now. But the problem is, from my calculation, if we get to something comparable to Korea, a reproductive rate of 0.8, because our number got so high, from what I'm seeing, it would take about 9 months before we actually got to 0 cases. Different people, different universities have different models that say this. The one that is being touted by the government and most, CNN, things like that, are saying this is going to be over in June or July, are assuming that we will have Chinese-like drop afterward. That's a lot of big assumptions. Hey, the Chinese shut down that city. Their lockdown was extreme. They basically declared martial law. They had the military and the police in the streets checking people for fever and locking people in their apartments. I mean, one guy in China did an interview recently where he was in his apartment for 79 straight days, and the government actually had brought him the food and delivered it, so he didn't leave his apartment for 79 days. We're not doing anything nearly that dramatic in the United States. So why would we assume we could get a reproductive rate of something like 0.6 or 0.5? On top of that, we don't know. The Chinese could have been lying about their data this whole time. So assuming we'll get Chinese-like data numbers is very optimistic. I would say even assuming we'll get Korea-like numbers is a bit optimistic. So where does that leave us? Can we actually wait 9 months through all this? If you haven't been paying attention to the news, things are getting pretty dire. There are more people unemployed right now than I believe during the Great Depression. And food bank lines are actually starting to look a bit like the Great Depression. So the discussion right now that I'm hearing everywhere is, when can we reopen things, get people back to work, go back to normal? And I feel like that's kind of a crazy discussion to be having because we haven't even peaked yet. So let's look at a hypothetical where we peak for a bit and we see our numbers are going down. Let's say we have that reproductive rate of about 0.8. And because the numbers are going down, we say, hey, we can start gradually opening up certain sections of the economy. People can go back to work, back to school, whatever. We'll be safe, we'll wear masks, we'll try to monitor things, we'll have more testing. If that reproductive rate inches even the slightest above 1, let's say 1.1, we will be back to right where we are right now in a matter of months. And why would that be bad? Again, sorry to be grim, but if you haven't been watching the news, so many people are dying in New York City that they're actually having to dig mass graves for them now. They're having somewhere between 500 and 1,000 deaths per day. So it's really not looking good. I was debating as I was working on all this stuff if I should even share it, because it's just such doom and gloom, bad news. And I had a few conversations with people, and I think generally speaking, it's better to know what's going on than to not know what's going on. So I thought I'd share it with you guys. What's going to happen? What's this all mean? So there may be a bit of good news, and I will discuss that next week when we talk about the different aspects of epidemiology. Namely, if we're looking at the model, there are some really key factors here in death rate and hospitalization rate, which we really don't know yet for this virus. And there could be a bit of good news there. There's also potentially new drugs that are going to become available, medicines that will improve those death rates and hospitalization rates. If you can improve those numbers, then it doesn't matter as much how many people become infected, because fewer people will become hospitalized and die. that would be kind of the only good that could come of this. But the idea that this is just going to go away is so bleak right now. As far as I can tell. I could not come up with a creative way to talk about reproductive rate of viruses using my dogs. So I will answer a few questions that you guys put out in the hub about coronavirus. What questions did you guys have? So one question that I had was, how do you actually get the coronavirus? Maybe it's from a dog licking your mouth. And do masks actually work to prevent the spread? One, mainly you get this, it's what we call a respiratory disease. So it is spread just like the cold or the flu, where somebody coughs and shoots out little bits of saliva and spit and mucus when they cough, and those little bits of things float on the air. Those are called aerosols, and those little droplets carry the virus and they land in somebody else's lungs. Do masks actually work to prevent the spread of the virus? Yes, in two different ways. If somebody is wearing a mask and they cough, all those little droplets get kind of stuck in the mask. Maybe a few make it out, but generally that would reduce the spread. If somebody's wearing a mask and the little droplets are floating around them, they may not get into their lungs, and that would also reduce the spread. So yes, wearing a mask in public right now is a good idea. I think everybody should be doing it. I had another question. Do I believe in any of the conspiracy theories right now? Not really. I might be formulating a few of my own, but no. I remember the earliest conspiracy theory is that the coronavirus was a United States bioweapon, and that we were trying to like kill the Chinese and the Iranians and the North Koreans because those were the countries most affected. So that was a conspiracy theory. How did that one turn out? Kind of dumb, because now the United States has way more cases than anybody else, so we managed to kill ourselves with our own bioweapon. I don't buy any of them. And I guess one conspiracy I could buy is that, in March they said that things would be opening by Easter. Easter comes around, things ain't opening. Now they're saying it's going to open in May. May's going to come around. Then they'll say June, and they'll say July. I think that, I guess, would be something I'd buy, is that basically they're lying to you in terms of how long this is all going to last. I could buy that. I had another question. If they put me in charge, what would I have done differently, or what could we have done differently to prevent this catastrophe in the United States? Again, I'll show that curve where you can see the United States is way worse than any other country on the planet right now. Right now, what would I do differently? I think I would be a lot more aggressive with the quarantine and shelter-in-place efforts. I would shut down more things, and in particular, grocery stores, I think, are a place where lots of spreading can still happen, and we need to begin limiting the number of people in those stores, and everybody needs to be wearing a mask if you go into a grocery store, that kind of thing. That's probably what I would do now. If I had been in charge from the get-go, yeah, I mean, I saw all that's happening, and I predicted it was all going to happen like early February. So how was some bum teacher in Texas able to predict all this, and the government was caught unaware? Yeah, so there are plenty of things to be done differently over time. All right, so those are 3 good questions I saw. I'll keep doing those. more and more as I see them. Anyway, take it easy and stay safe. Hope everybody's doing great out there. This is going to last a long time, is my prediction. Many months. And one way to kind of stay sane through all this is by having some things that you can enjoy in life, which is why I keep bringing my dogs into it, because, you know, that's part of what's keeping me going through all this. So good luck, stay safe. I'll talk to you guys next week.